ADT notification is a narrow slice of information that gets proactively pushed to care teams when a person they're responsible for has an interaction with a hospital. Could be the emergency department, could be the inpatient setting. But I want to note for everybody, an ADT notification is not a full medical record. It's not a complete health record. It's this slice of information that tells the care team really core things like when their member or patient, where and why their member or patient is at the hospital. And that narrow slice of information is what enables a care team to take action. It's also, I can't emphasize enough the importance of the proactive push, and some of my colleagues may talk about this. Care teams don't have to query for this information and look it up. We have very clear and consistent evidence that ADT notifications improve clinical outcomes, ultimately improve the quality of life for the people who are cared for based on those notifications, and reduce the overall cost for our healthcare system by reducing things like avoidable readmissions. So lots of potential power and value in what is a fairly simple setup from a technology perspective. The CMS condition of participation, many of you are probably familiar with, requires hospitals to share ADT notifications with community providers. That's been in place for about 2 years now. And while it has, I think, without question, expanded access to ADT notifications across provider communities, it kind of creates a messy ecosystem when you don't have a broker sitting between the hospital and the recipients of the ADT notifications to manage those ADTs, match those against patient panels or eligibility files, subscription files, and then appropriately deliver the notifications to the key participants. I'll also note that the CMS condition of participation leaves out a broad range of key stakeholders that are critical in the state of California for what are some very ambitious policy efforts. They don't require notifications to go to health plans, for example. They don't require notifications to go to community supports and other social service providers. That as we lean into a more holistic space around community care, become really important on the ADT notification front.